Most parents are psychologically stressed when they see their young children normally bedwet, particularly when they are passing the age of which the bladder should be able to take control of itself. Now, nocturnal enuresis, or so-called bedwetting, is an involuntary passing of urine while somebody is sleeping unknowingly, and this one affects most of our children and even adults. And we should be able to know that bladder control should be at an age of 5 years to 7 years, and this is now a child can be able to know that I want to wake up, I want to pass urine, other than bedwetting. So if you love this channel, click the notification bell written, subscribe, turn it on, because we are going to discuss causes of bedwetting and how we can manage this, and to help our children and even adults who are bedwetting in this particular video. Welcome again, and let's go and let's do it.
Bedwetting is also tied to psychological stress affecting a child, or even affecting an individual, or even stress related issues like bullying in school, death of a parent, loss of a pet, sexual abuse. This normally contributes to a psychological disturbance of this child and developing imbalance in terms of emotions, and this child may be able to pass urine unknowingly at night. Children who normally suffer from sleep apnea may be due to airway obstruction, and those who are normally having adenoids, tonsillitis, are also prone to bedwetting. Chronic constipation plays a lot in bedwetting because they pose pressure to the bladder, and this one may make a child to develop bedwetting unknowingly. Diabetes type 1, or what we call juvenile diabetes, is an autosomal disorder that normally interferes with the immune system of the child, and this one normally attacks the beta cells of islet of Langerhans or pancreas, and this normally interfere with insulin production, thereby bringing what we call diabetes insipidus, and this one may make a child to pass a lot of urine, and this also contributes to nocturnal enuresis. So this is called excess passage of urine at night due to diabetes insipidus. But in adults also we have what we call diabetes mellitus, which is increased blood sugar. This one also can contribute to excess production of urine, and this may also affect adult when this particular adult is sleeping, and he will realize that he or she has passed urine involuntarily. Children who are handicapped, or those who are suffering from attention deficit hyperactive disorders, forms a very bigger percentage in children who are bedwetting. Sleepwalking also form part of nocturnal enuresis, because a child might be able to walk while sleeping and then come back again to sleep and realize that she or he has passed urine unknowingly. Management of nocturnal enuresis or bedwetting is normally case by case. Just as I've mentioned, we'll consider the production of antidiuretic hormones. We'll consider whether there is an infection and treat, whether there is tonsillitis, whether there is adenoids, or whether the child has constipation. As parents, we should be able to know that all children, regardless, will outgrow bedwetting by the age of 6 to 7 years. But when there is an occurrence of bedwetting after 7 years, we should be able sometimes to delay a treatment in terms of drugs. But what is very, very important is motivational therapy. Motivational therapy is very, very key in management of nocturnal enuresis. One of them is that we should be able to restrict coffee or even fluids almost 2 hours before bedtime, and also we encourage them to take their beddings outside or to aerate their beddings if at all they have bedwetted. This one will make them feel that they are part of what is going on, rather than talking to them badly or shouting to them or caning them or even denying them food. Research has shown that if you do that, then the problem might even triple or worsen. Sometimes we might buy alarms that have moisture detectors, that if a child has passed urine or is beginning to pass urine, then the alarm will be there to wake up the child. Or we can even task an adult who has learned the time of which the child is likely to pass urine at night, and this adult will be waking this child and encouraging this child to go and pee. Also, we can even buy for them absorbable pants, so that if they bedwet, then these pants will absorb the urine and they will have a dry night. We must also be able to encourage all our children to empty their bladder or to urinate or to micturate just some few minutes before they go to sleep. And also adults can also do the same, because it will really help them not to bedwet. Desmopressin is the drug of choice in management of nocturnal enuresis, and normally it is placed under the tongue 1 hour before bed. And note that as a precaution, it should not be used in children under the age of 6, and this is because of what we had discussed earlier, that the bladder of the child normally attains its function very well in terms of detection of how bladder is full from at the age of 5 to 7 years. So in this drug, it is precocious not to be used in children under the age of 6, and you should be able to do more consultation before you are given this drug. And then this drug is not over-the-counter drug. It's a prescription only medicine that the doctor may only issue it, clinical officer or even a nurse, after he has verified the age and outweigh the benefits of risks versus impotence, particularly when a child is between 5 and 6 years. It is important to know that desmopressin normally slows down urine production, and this will help the child to stay night long without bedwetting. Oxybutyrate is also a very important drug in managing of bedwetting, because it normally relaxes the bladder and allows the bladder to hold urine for a longer time. And also it should not be used in children who are below 6 years. All drugs I've mentioned here should be prescription only medicine. Let's take note of that. If you love this video, please click the notification bell written subscribe, turn it on, share, comment, and always visit our YouTube channel. See you in the next video. Muchas gracias.